It was just past midnight when a 25-year-old woman was rushed into the emergency department. Her vital signs were unstable, her body was failing, and her life was hanging by a thread. She had ingested up to 72 tablets of Imipramine, a powerful tricyclic antidepressant, and no one knew exactly when it had happened. By the time she arrived at midnight, she was already in a critical condition. Her heart was beating irregularly. She was unconscious, and her body was beginning to shut down. What followed was a desperate medical battle against a deadly overdose, cardiac arrhythmias, seizures, and severe metabolic acidosis. Imipramine, a medication once widely used for depression, has a dangerous side when taken in excessive amounts. It affects the heart, brain, and multiple organ systems. In this case, it had already pushed the young woman into a state of wide, complex tachycardia, a dangerous form of irregular heart rhythm. Upon arrival at the hospital, she was immediately intubated to protect her airway and ensure she could breathe properly. She was sedated with propofol and fentanyl to keep her calm and prevent agitation. She suffered a life-threatening heart rhythm disturbance known as toxicity de point 3 times. She received 13 doses of sodium bicarbonate to counteract severe metabolic acidosis in her bloodstream. Lidocaine was considered as a possible treatment to stabilize her heart rhythm. A discussion took place about using extracorporeal membrane oxygenation, a machine that temporarily replaces heart and lung function in life-threatening cases. Despite these aggressive treatments, her blood pH had dropped below 7.0, indicating life-threatening acidity, and her lactate level had risen to 12.0 millimoles per liter, which was a sign of severe shock and poor oxygen delivery to her organs. Imipramine poisoning is extremely dangerous because it 1. Blocks sodium channels in the heart, leading to a dangerously widened QRS complex and life-threatening arrhythmias. 2. Lowers the seizure threshold, significantly increasing the risk of dangerous convulsions. 3. Causes severe metabolic acidosis, making the blood dangerously acidic and impairing vital functions. And 4. Triggers extreme low blood pressure and circulatory shock, requiring medications like levosimendan and norepinephrine to keep her blood pressure stable. With no exact ingestion time known, the doctors had to assume the worst-case scenario and act with the most aggressive treatments available. As her condition continued to worsen, the medical team worked tirelessly. Magnesium and potassium were aggressively replaced to prevent further heart rhythm disturbances. A continuous infusion of sodium bicarbonate was started, despite concerns about an increasing sodium level in her blood. Lidocaine was suggested to counteract the toxic effects of imipramine on the heart. Continuous brain monitoring was initiated after she suffered a seizure. A special heart-lung machine was kept on standby in case her heart completely failed. By 3 o'clock in the morning, her condition remained critical. Her QRS complex remained dangerously wide at 140 milliseconds, increasing the risk of cardiac arrest. Her potassium level had dropped to 2.6 milliequivalents per liter, a dangerously low level that could worsen her irregular heart rhythms. Her blood pressure was barely holding at 128/61 millimeters of mercury. After nearly 6 hours of intensive treatment, small signs of improvement began to appear. Her blood pH had improved to 7.53, indicating recovery from severe metabolic acidosis. Her potassium level was corrected, reducing the risk of life-threatening heart disturbances. She no longer needed medications to maintain her blood pressure, which suggested that her circulatory system was stabilizing. Her heart rate had slowed down to the 90s, a significant improvement from the dangerously high rates earlier. However, challenges still remained. She developed an extremely high sodium level of 160 milliequivalents per liter, possibly due to the excessive sodium bicarbonate administered earlier. She remained intubated and sedated, though she had started showing some minor neurological responses. Her liver enzymes were rising, suggesting possible liver damage either from the overdose or from the shock her body had endured. The medical team debated whether they should continue using sodium bicarbonate or switch to adjusting the ventilator settings to help correct her blood pH more safely. By the evening of March 13th, her condition had stabilized further. Her QRS complex had narrowed to 146 milliseconds, indicating improvement in her heart's electrical activity. She had developed a fever of 101 degrees Fahrenheit, possibly due to aspiration pneumonia from vomiting during the overdose. She was making purposeful movements, a promising sign of neurological recovery. However, she remained on mechanical ventilation, and concerns about a prolonged QTC interval and residual drug toxicity remained. Imipramine is a tricyclic antidepressant that can cause significant toxicity when taken in excessive amounts. It is important to recognize the signs of toxicity and provide appropriate treatment as soon as possible. Mild to moderate imipramine toxicity. Toxic dose: children, more than 5 milligrams per kilogram. Adults, 300 milligrams or more. Adolescents and elderly individuals, 100 milligrams or more. Symptoms of mild to moderate toxicity: feeling sleepy or experiencing a state of reduced alertness. Increased heart rate, seeing or hearing things that are not present. Dry mouth, difficulty urinating, and other effects related to reduced nerve signaling. Treatment for mild to moderate toxicity involves several key steps. Administering activated charcoal if the overdose occurred within 2 hours is crucial. Carefully monitoring the airway, blood pressure, and heart rhythm is essential. Managing seizures if they occur, controlling temperature, and ensuring patient safety are also important aspects of the treatment. Who needs medical attention? Well, any person who intentionally ingested imipramine should seek medical help. Additionally, anyone who took an unknown amount or is experiencing symptoms such as dizziness, tremors, drowsiness, or palpitations should get medical attention. Severe imipramine toxicity can be quite serious. The toxic dose varies. For children, it's more than 5 milligrams per kilogram. For adults, it's 300 milligrams or more. And for adolescents and elderly individuals, it's 100 milligrams or more. Symptoms of severe toxicity include loss of consciousness or unresponsiveness, seizures, abnormal heart rhythm, difficulty breathing or slow breathing, dangerously low blood pressure, and slow movement of the digestive system, which can lead to difficulty passing stool or delayed drug absorption. When dealing with severe toxicity, it's crucial to act quickly and efficiently. Administering activated charcoal within 2 hours is essential, ensuring the airway is protected. Immediate medical care should include supporting breathing and circulation, controlling seizures, monitoring and correcting abnormal heart rhythms, and stabilizing blood pressure. In some cases, considering intravenous lipid therapy might be necessary for patients who develop life-threatening heart problems or dangerously low blood pressure. Knowing when to seek medical attention can be life-saving. Any person who intentionally ingested imipramine, took an excessive amount even unintentionally, or is experiencing symptoms like weakness, dizziness, confusion, tremors, abnormal heart rate, or breathing difficulties should seek medical help immediately. Imipramine toxicity can range from mild effects to life-threatening complications. Early medical intervention is essential to prevent serious outcomes. If an overdose is suspected, immediate medical evaluation is necessary to ensure safety and proper treatment. This case demonstrates the lethal nature of imipramine overdose and the intensive medical interventions required to pull someone back from the brink of death. The patient survived the initial crisis, but her long-term neurological recovery remained uncertain. This case serves as a critical lesson in the dangers of tricyclic antidepressant overdoses, the importance of early and aggressive medical intervention, the delicate balance of managing acidosis, electrolytes, and cardiac stability in severe poisonings. Tricyclic antidepressant overdoses remain a serious medical emergency, and this case highlights the complex decisions and rapid interventions needed to save a life.